This is Speaking of Pets podcast, where we offer you up-to-date, science-based, accurate information.
Oh, Gizmo. Good kitty. You're such a good kitty.
And they're looking up and howling in unison.
If it affects pets, we'll talk about it. The Speaking of Pets podcast is sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. And Vetramax Veterinary Supply. Vetramax makes it better. Hey everyone, welcome to Speaking of Pets. I'm Dr. Alice Novotny-Jerome, a board-certified veterinary dermatologist, and
I'm Janet Novotny-King. I'm the doctor's sister. I'm not board-certified or medically anything other than I go to shop at CVS or Walgreens. But we're here to provide you with science-based information so you can become a better pet owner. I know my sister's sick of me calling her at 2 a.m. with dumb pet questions, but hopefully we can answer some of yours and make you a much better pet owner and lover. So, Al, who do we have today? I hear there's a Buckeye in the house.
There's a Buckeye in the house. As I said in the intro, we have Dr. Karen Tobias, who is a small animal professor and surgeon at University of Tennessee, Knoxville. But our paths crossed unknowingly to her in the 80s when I was a vet student. Wow. And she was a resident and getting her master's at Ohio State. And I have to tell you, Dr. Tobias, I remember what my memories of you, because I was older. I was 31 when I got into vet school. I was a pharmacist before that. So
Geezer.
I was geezer. I was older, and so I appreciated worker bees, things like that. And I always remember Dr. Tobias just always scurrying around and always busy doing something. And then she was this petite, cute surgical resident, and all these other surgery were like these big burly ex-football player types. And I greatly admired that. I thought, look at her go. You go, girl. So I'm so glad that we finally got to meet and plaster you with all of our questions.
Well, it's going to be fun.
So where are you originally from, if I may ask?
I'm originally from around Chicago, Illinois.
Oh, so you're a Midwesterner like we are.
Right.
She talks like we do, Janet.
I don't really talk like that anymore. Only because I've moved around.
Yeah. Yeah, but Janet, as you probably come to know with all of our guests on the show, as vets, we've lived in 18 million places.
Yeah.
Right.
Which is amazing to me that vet students who always have had pets could find rental places that allowed pets.
Right.
Wow.
Yeah.
Wow.
So anyway, Janet, why don't you start?
Okay, so I guess we want to talk a little bit about spay and neutering because our listeners have a lot of questions about it. So surgically, what is involved in a spay and neutering surgical procedure?
I think the classic definition for dogs and cats for neutering is removing the testicles. And the classic definition in the United States for spaying is removing the ovaries and the uterus, although you don't have to remove the uterus as long as you take the ovaries out.
Do most veterinarians remove both the uterus and the ovaries? Is that kind of standard in the U.S.?
I think most general practitioners remove both. If we're doing the procedure laparoscopically, so a minimally invasive procedure, we just take out the ovaries because that is much faster.
Oh.
Now, is it different in different countries?
Which part of it? What they remove? Or
Yes.
I would say that there are a lot of countries where they don't neuter at all. They don't spay.
Right.
They don't do castrations. When they do neuter these animals, for the most part, I think they're using the traditional techniques. So I think it's the United States that has some more unusual techniques, like the hysterectomy, where you leave the ovaries, but you take out the uterus.
Interesting. So
Janet,
I
have to ask Karen, and I know you've never heard of this, but would you explain what Neuticles are?
Oh, we have a T-shirt. And by the way, Karen, Joanne is one of our producers who just joined.
Hi, Joanne.
This is her off the street.
Okay, Neuticles.
Yeah.
What are Neuticles?
That Neuticles are also one of those things you see in the United States, and those are artificial testicles, and that's probably a specific brand of artificial testicles. So,
Oh, there's more than one brand.
Well, I that is not something I search around. There's certainly more than one different kind. So if you
Oh
go
my
on the
gosh.
Neuticle site, you can find like the standard balls, or you can have some that feel much more realistic, or some that are soft and pliable. Now, I just think it's a little weird that people are going around feeling these things, and you
Yeah.
know, what?
And I'm sure the pet, I'm just going to ask, does it matter to the animal?
Right,
To the dog?
scientifically or medically?
Anything?
There is no reason to put them in. It is
Okay.
all something that is in the
Cosme-
mind of the owner.
Cosmetic.
Cosmetic for sure.
Have you ever seen Neuticles done badly, like a bad facelift, like
Yeah,
bad balls?
add Neuticles.
Excuse my French, but
Yes, so because you're putting an artificial substance in, you have the risk of getting an infection. And most dog castrations, there's a risk of contamination because we don't clip widely because those private parts can sometimes be a little sensitive, and because the dogs tend to go after these incision sites anyway. And so if you are putting an artificial body of rubber and plastic in there, there's the risk that they could have terrible infections. Yeah.
wow.
So it's definitely something that's cosmetic, and it's definitely only for the owners. There's no reason to do it. It's a lot like ear cropping. It's one of
Oh.
those things that's cosmetic.
So what are the benefits of spay and neutering for both cats and dogs for our listeners?
I would say if I were to have a cat, I would always want it to be neutered.
Oh, yeah.
because,
Yeah.
Number one, I would not want to live with an intact male cat. And the smell
Yeah.
and
Oh.
fighting and all those types of things. If those cats are spraying, it's very hard to get that scent out of your house.
Oh, so that's why male cats spray?
That is a territorial thing,
I
right?
didn't know
And
that.
if we neuter those cats at an early age, they're not going to go around and spray things. And
Wow.
if they do, the urine isn't going to be as strongly scented. I think for the female cats, it reminds me of when I was in veterinary school, and I actually answered phones at night from 10 o'clock at night till 8 in
Yes.
the morning.
Yeah.
And I remember getting this call from an owner who said, I have a cat and she's laying on the floor screaming and moaning. And I said, oh, you better bring her right in. And I called the intern on duty, and he said, is she intact? Oh, was I supposed to ask that? Oh, that's what they look like when they want to be bred.
I love
I
it.
thought it was
I love it.
excruciating pain.
That as senior students, we were also put on phone duty at night, Dr.
Yeah,
Tobias.
there you go.
And I have to tell you, the most common question I ever got was, can my dog get lice from me?
Oh,
And I'm
Oh
like,
my God.
whoa. And the answer is no, because it's species specific, like dog lice stays on the dog lice. But yeah, you know what? We should put those questions in a book because
absolutely. I think, even a once a week little podcast short of answer me this.
hey, I'm just curious, who is your supervisor that corrected you? Do you remember?
Well, it was one of the interns.
Oh, it was
at
one of the interns,
University of
okay.
Illinois. It was an intern, so
Oh,
they were
Illinois.
the
Okay,
first
so I would
line
know.
of defense for emergency calls. And I had just told the owner, "Come on in." So there we are.
Because you're going to be going off duty.
Well, actually, I was there to receive the cat. So hey, I learned a lot that day. I'd never been with a female cat that
I
was
know.
in heat. Oh my
I
God.
know.
So did you put like some sexy lingerie on her? Bring it on.
No, we got a Q-tip out, and we
Yeah.
made her feel better so she'd
Yeah.
stop
Aw.
screaming.
It's really sad when you think about it. I mean, they can have kittens like that.
Right, right. And so for population control and
Mm-hmm.
and just behavioral wise, that's I think it's good to neuter the cats. It's very rare to have a breeding population of cats that you really want. And so I think
Yeah.
for cats that it's an easy decision because there's not a lot of side effects to spaying and castrating cats.
Is it
Is it
harder?
true?
Just,
But
oh,
is
go
it true female cats can get pregnant with two different male cats?
Oh, now you're reaching outside of my surgical zone.
Okay.
I
I I read that somewhere and I was like, wow.
I mean, I would assume it'd be possible, but
And then are they step cats? I mean, you know what I'm saying?
Oh, God.
half sisters, half brothers. Yeah.
Yeah. So what's the proper age? Like, what's the appropriate
Oh, right.
age for kittens and puppies to be spayed? A
Well,
healthy age?
puppies are a totally different consideration. That
Yeah.
one is going to take a lot of thought. I think for cats, one thing is that they have more difficulty, any of our dogs and cats have difficulty processing anesthetics before about 12 weeks of age.
Oh.
And so most of our anesthesiologists for the owned pets, they would much prefer to wait until the animal can process anesthetics well and can maintain blood sugar and can warm themselves up. And the younger they are, the harder those things are to do. Now, it's a different situation if we're working at an animal shelter, because we know that spaying and neutering cats before they leave, and the same with dogs, is more likely to get those animals sterilized than if you send them out the door with them intact and then give people a coupon to bring them back in. There's not as much follow-up as there should be for
Right.
those animals. And so I think the easy thing about doing the spays and castrations at 8 to 10 weeks of age in cats is that everything's small, you don't need a lot of materials, you don't need a lot of anesthetic, the surgery's pretty quick, and it's pretty uncomplicated for somebody who does it all the time.
But
Now-
but dogs are a different story.
Dogs are a totally
Okay.
different story. It's very size related and breed related, and so that takes a lot more thinking.
Wow.
So some people, their vets are telling them with female dogs to wait a couple of cycles before they have them spayed. Is that a good thing, a bad thing? Is that widespread practice?
I think that it is going to become more widespread, and that's because of all of the research that's been coming out about effects of early age spaying on joint development, on cancer development, and I think those types of things, urinary incontinence, which if you end up with an incontinent dog, that is a major cause of euthanasia. So there are some breeds where it's going to be very important to delay castrations and spays because of those issues. And it's not, that doesn't hold for all breeds. It's so far it's very specific. The paper that came out covered, I think now 40 breeds plus mixed breed dogs. So we don't know for every breed. And unfortunately, it's not always consistent. Like for those breeds, they saw big issues with German Shepherds and Labrador Retrievers, Golden Retrievers when we neutered them early, but they didn't see issues with Great Danes. And so that you would think a giant breed dog, that should be something where you really get worried about it because they take so long for their growth plates to close and things like that. But it is very much breed related.
Now, what about, Dr. Tobias, we had a local vet in our hometown in Ohio that when he would spay a female dog, a big chested breed, they would quote unquote tack the stomach. Can you talk about that? Janet, I don't think you've ever heard of that.
Tax?
T-A-C-K, tack.
Oh, tack. We heard about doing something with the stomach though in the Great Danes because it flips.
Right.
It's probably not the right.
No, that is a
correct.
good descriptor of it. It's called a gastric dilatation and volvulus, and the stomach turns on itself, and it is very commonly deep-chested dogs. And in fact, they've seen some familial problems with Great Danes, where if one or two puppies in the litter get this condition, the other puppies in the litter might be more predisposed to it. So there is going to be some hereditary aspects of it, but any of these deep-chested dogs, any of these expensive working dogs, any dog that's anxious and panting and things like that, we even see the doodles having this condition. And when the stomach flips, that can actually kill them. And so for these deep-chested dogs, the recommendation is to tack the stomach over to the side so it can't turn on itself. The problem is if we tack that stomach at about 6 months of age, and you have a dog that continues to grow, and you can imagine how much a Great Dane changes from 6 months of age to 18 months of age. We've had the stomach actually kink itself off after it's been tacked. because you can't predict which way does the
Yeah.
animal grow.
Oh, my goodness.
Does the stomach go that way? Does the chest go that way? And so there isn't a really good study on what's the appropriate age. Most of us feel that those animals need to be close to their mature size before we do that. And that means if you're doing a female dog, if you want to do the 2 procedures at once, that you wait until those animals are 9 to 12 months of age, depending on the breed, 12 months for sure for the Great Dane, because they get so much bigger. And that way you don't take that chance of having the stomach
never thought of that.
malposition. Which
Makes
means that
sense.
those owners are
Makes
probably,
sense.
or those owners, the Great Dane's probably going to go through a heat cycle before then.
Wow.
Hey, did you know that Blue Buffalo makes prescription diets that are formulated by animal nutritionists and veterinarians? And they're used for dietary needs such as kidney support, gastrointestinal support, weight management, and our favorite, allergy and skin problems.
They make a food allergic diet that's an alligator based called NP or a hydrolyzed salmon based for dogs and cats called HF.
So please, ask your veterinarian about Blue Buffalo prescription diets.
Now there's soothing relief for your pet's irritated skin from allergic response, contact allergens, and insect bites. Atopic Cream HC by Vetramax is a unique anti-inflammatory, rehydrating leave-on lotion conditioner for animals that is quickly absorbed, providing sustained benefits while leaving no residue. Fortified with ceramides, these lipids help restore the skin's natural protective barrier and aid in healthy skin regeneration for your pet. Atopic Cream HC is made in the USA and not only provides quick relief for irritated skin, but it's also an aid in detangling your animal's coat. Ask your distributor about Vetramax products. Vetramax makes it better. Now, what about small breed dogs? What's the research show on them, like little poodles and Maltese and all the
Yeah.
mixes? Oh my goodness.
So I think that for the mixed breed, let's start with that, because for the mixed breed dogs, what they found was that if the mixed breed dogs are less than about 20 kilograms,
Okay.
so 44 pounds, probably doesn't make a difference.
Okay.
Unless they're half and half. Now, doodles are mixed breed dogs, right?
Right,
They're half standard poodle and half golden or half lab. So what you have to figure out is, what is my dog a mix of? If I have a Bernie doodle and I have a Bernese mountain dog, is it going to be more prone to getting histiocytic sarcoma of the joints or something like that? So it does depend on if it's, strong mix, like the two breeds put together. But for the most part, if we're looking at smaller dogs, it's going to be less of a problem in terms of joint disease. Now, there's still an increased risk of incontinence. So when we are spaying dogs at less than 7 months of age, 8 months of age, then there's going to be that increased risk of incontinence. And that's where letting them go through a cycle to strengthen up their sphincter, because you have the effect of estrogen on their sphincter, and making that hopefully a little bit tighter, maybe that will reduce their chance of having that incontinence. And one of the classic incontinence breeds is a Sheltie. So that's a little dog, right? So, of course, other incontinence breeds, Doberman Pinschers, that's a big dog. So when you think about trying to adjust when you're going to spay these animals, it's not just the size, but there's also these breed-related issues.
Wow, so much involved.
Yes.
Really?
Yeah.
And honestly, as a pet owner, it's like when you get a puppy, it's, well, we'll make an appointment for your spay, or,
Right.
it's very routine.
Right.
But it's pretty serious surgery.
It's serious surgery, but the important thing about making this consideration is that anybody who delays the surgery needs to think about, first of all, how am I going to manage my pet? If I have an intact animal, what do I need to do if it goes into heat? Guess what? If I have an electric fence, maybe my dog can't get out, but the other dogs can come on in.
Party in the hood.
Puppies, yeah. What are these puppy panties that my dog has to wear? So you have to know things about that. And then the other thing that's important for owners to realize is that if we are going to do a spay properly on a big dog, a mature dog, it's going to take more time, it's going to take more equipment, and there's a greater risk of complications. And everybody thinks, well, I'm going to go in for a spay and I'm going to have a little tiny incision. And no, we've seen with our change in recommendation here at University of Tennessee, we have seen an increased rate of hemoabdomen where the dogs are bleeding into their bellies
Oh my gosh.
after the surgery. And that is because the veterinarians are kind of bowing to owner expectations. Oh, I only want a little shave. I only want a tiny incision. Well, that's not the safest thing for your animal. It's actually a lot faster to do the surgery if you make a bigger incision. You're not pulling on things as much and stuff like that. So that's where the owners have to become invested, because there's a financial investment to that as well. If you have a bigger dog, it should cost more to have these procedures.
Interesting. When we got our kittens, it was during COVID. They were new, I mean, really little, like 8 weeks old, and we had to take them back to get fixed, and we did. And male and female, and the female, Isabel, ended up getting infected where the sutures were, because Atticus was, helping her clean and doing all kinds of stuff, right?
Right.
And we figured it out because she was lethargic and was very, very warm, like her belly, and took her we have Cornell after hours, and they were fantastic, but it was a little scary. That thing went from this vibrant, fluffy kitty to complete lethargy. So,
Right, and besides having to limit your large breed dog from its friends at the house who are going to be helping it out,
Right.
how are you going to deal with that giant e-collar on that giant Great Dane and it running into you? You got to
It's
do
like-
that. So now as veterinarians, we have to kind of get imaginative and say, well, you want to purchase a recovery suit. We've got Lycra body suits that the dogs can wear, so it covers the incision line, because it's really hard to get owners to keep e-collars on their dogs. So,
well, what's
And
that
Janet,
line? It's no
can
fun
you-
till somebody gets a cone on their head.
Yes. Well, and can you imagine if they lick that suture site? Oh my gosh, that could
Right.
be a disaster.
right,
Well,
and
that
the
happened
bigger
to
the
us.
dog, the bigger the incision, the more likely there are incisional complications.
I think if Isabel had been a single cat without the brother, it would have been a whole
Oh, you
different,
think it
you
would
know?
be, yeah.
I think it would have been a different situation. Which, by the way, I never make tuna salad because nobody else eats it here, just me. And today, I thought, yeah, I'm craving like a tuna fish salad sandwich,
Yeah,
right?
that does sound good. Yeah.
Doesn't that sound good?
does.
So I made the toast, and I've got the can open, and I'm mixing it with a little bit of the mayo. Who do you think is my BFF?
Yeah, I bet.
The male cat who can't stand me is in the kitchen, like rubbing against my legs. I'm like, you never come near me. You hate my guts. And now, Miss Chicken of the Sea, you're my best friend.
Yeah,
And
but
did
was
you fall
that
for
because, was that the sound of the can opener? Or
No, they don't know that.
I know they don't know. That's why I was asking.
No, it was the smell of the tuna.
Yeah.
And that thing was hanging out with me, and I'm like, get lost, buddy. Like, seriously, I walk in the room, Dr. Tobias, and the cat goes,
Yeah, they don't like you, Janet.
no, just the male cat doesn't like me.
So, Dr. Tobias, if you adopted, and not from rescue, because when we get a dog from rescue, they're all spayed and neutered, as they should be.
Right.
And same with cats. But say you adopted, let's say, a Bernese Mountain Dog puppy. I know. I know. Okay, golden retriever. And, and you didn't get it from rescue, which I know we all would, but, so then you would, and it was a male.
Oh.
So you would wait till what, a year and a half, 2? Or
Yeah, so for the males, I think for golden retrievers, you want to wait till they're at least 13 months of age before you neuter them.
okay.
And that is because of the risk of joint disease. Like for golden retrievers, let me think now. I'm actually gonna scroll back to some of my data here. Yeah, there we go. So if you castrate a golden retriever at less than 6 months of age, there's an 18 to 27% chance of joint disease.
Oh, wow.
So you're
Now-
looking at 1 in 4, 1 in 5 of those dogs having joint disease. If you castrate them at a year of age, it's 10%. If you leave them intact, so at least 2 years, you're looking at 3 to 5%. So when you're looking at lifelong pain and suffering to the dog,
Yeah.
and you think about an animal having ruptured cruciate or hip dysplasia, if we can get them through that growth phase so that all of their growth plates close and they develop good muscle mass, then that is going to help those animals. Now, it's not been directly correlated to weight gain, but we do know neutering them does increase their weight as well. And some of it may be, well, they're just reaching an age where they're not as active. But we know in cats their metabolic rate slows down, and in dogs they tend to gain weight for other reasons, but they tend to gain weight after they're neutered. So if I were to have a large breed dog that was going to be neutered after a year of age, I would definitely go for a male because I can figure out how to manage those.
Oh,
Yeah, right.
that's a good
Females are
point.
trickier, man.
Okay, so this might be, I don't know if this is true or not, but I heard, somebody told us, because we had an old male golden that was neutered at like, I want to say 4 or 5 months, very young, and he could never lift his leg when he peed.
So that I don't know whether that is.
He was a squatter.
Yeah, it's probably not a mobility thing. It's probably more of a behavioral thing.
Yeah.
Oh.
And I wouldn't make fun of.
I didn't
him for that.
care as long as he was peeing, right?
That's right.
But I've had many people say, "Oh, he
Stand, it's
squats."
all good.
He squats because you had him fixed too early. I'm like, really?
Don't you love that? I just love the crazy myths that go along with this.
And of course, I have to Google all of them. 'Cause
Yeah.
I'm thinking,
No, and
oh,
that's
wow.
it's interesting that one of the reasons. Now there are a lot of different reasons as people choose to neuter animals, and one of the reasons for neutering male dogs was changes in behavior, and there have been some newer studies out on that, and what they show is that yes, at 1 year of age, an intact male dog is going to have more male behaviors than a dog that was castrated at 6 months of age. However, those behaviors gradually decline. So the only thing that doesn't really decline is going to be marking, urine marking, and there's not really a great percentage of difference. I can't remember. It was something like 75% of the intact males marked and 66% of the castrated ones marked. So it's what their owner thinks of as marking. They're peeing on the wall, so what the heck? But behavior-wise, it's actually a maturity issue. And that's why in Europe and England, you think about all those animals that are left intact. They go to the pubs with their owners. They sit quietly under the chair when they go to the restaurant. And they're all intact. It's because their owners have worked with them. And that's, unfortunately, we're sometimes trying to take the easy way out. And let's just fix this so I don't have to deal with this issue, when instead you could be working on training and exercise and all those things.
Now, with females, talk to us about the pyometra issue. Janet, do you know what pyometra
No,
is?
what pyro means what?
So pyo is an infection, and
Hang on,
metra
Karen.
is gonna be
Pyro
the
means
uterus.
fire.
Yeah, I know. I was thinking of pyrotechnics.
Fire. Okay, I got it wrong, Janet.
So a uterine infection,
Oh,
and because these dogs that are intact are going through these cycles where the uterus gets thicker and thinner, after a while they will have a much higher risk of having an infection in their uterus. But for most dogs, that infection happens after 4 years of age. And so if you're going to be delaying a spay, you're not going to have an increased risk of pyometra in those first 4 years unless the animal has something anatomically wrong with it. It is something that we have to worry about as an animal gets older and older and older, the risk gets higher. And that's the same thing with mammary tumors, is that the risk gets higher. And I think that is one of the things that people bring up. They say, well, we should spay these animals early because of the risk of mammary tumors. So you have to balance everything, because we do know that the risk is lowest if you neuter them before the animals go into their first heat. But if you say, well, the risk is like 0.08 times what it would be if we left them intact, well, what you need to know with each breed is what's the risk if they're left intact. And from the California study, now they didn't follow the dogs out to 14 years of age, so it's not a perfect study, but for instance, all the Westies that were in that study, none of them got mammary tumors. So their risk was 0%. So yeah, if you decrease the risk by 100%, well, 0 times 100 is still 0. So it doesn't really matter. So what you want to do is think about, well, this is going to be really important for breeds that have a very high risk of mammary tumors. So for instance, the Cocker Spaniels have a higher risk of mammary tumors. So that would be something that you might want to take into consideration when you are trying to think of when you should neuter these animals. But I've got a little sort of problem-solving slide that I show the students, and that is how to make these decisions. So if you have a Rottweiler, what you want to think is all together, what's going to be the most important thing? So the risk of mammary cancer in Rottweilers that are spayed before 2.5 years of age is 0% from this paper. Okay, so you spay them before 2.5 years of age. They're going to go through 1 or 2 heats. If they're intact, the risk is a little over 13%.
Oh,
The mortality rate is 36% for that, for mammary tumors. Okay, you got that in your mind.
Right.
yeah.
All right. Risk of pyometra, if they're intact for more than 4 years, is going to be 6 to 12%. And that has about a 7% mortality. Right? So, wow, maybe we should spay these. The risk of urinary incontinence in Rottweilers, depending on the paper, if they are spayed before 12 months, the risk is 4 to 6%,
Okay.
with many people euthanizing those animals because they can't live with a large breed dog that's that is incontinent. And then the risk of bone sarcoma, if you spay the animals at less than a year of age, is 14%. And that's almost 100% mortality.
Wow.
So when you weigh all of those things,
Oh,
and
gosh.
it's a lot of thinking, but you've got to weigh all of those things. You say, well, for a Rottweiler, you better not spay that animal until it's at least a year of age. It would be better to wait until it's 2 years of age because of the risk of bone cancer. If you leave them intact, the risk is 7%. If you spay them before they're a year of age, it's 14%. So it doubles the death rate of those dogs. And that's where each breed has to be taken into consideration. And unfortunately, there isn't data on each breed.
Right, and then if you have a mutt, you're not going to know, right? Unless you have the DNA thing.
Right, and that's where we just have to go with those general recommendations of the
Yes.
safest thing is if they're over 20 kilograms to wait till they're a year of age. But now somebody's got to get out there and tell people, how do I manage my intact dog until this happens?
Right. Or they'll end up in a shelter.
Right, yeah.
You can't just put a condom machine out in the yard.
Especially for cats.
Yeah. I just, out of my way.
Karen, is any of that true in humans? I'm just curious, comparatively speaking. I've not read that it is. I mean, yes, urinary incontinence in postmenopausal women. We see
Right.
commercials for that all the time, you know?
So that means it's true.
I think the question would be, do we have a data set on humans? We'd have to go back to, at least for males, the castrados, because we might have a data set. That's the young boys who were castrated so that they would maintain their high voice.
Right, right.
There might be a data set on those, but that's not really a deep dive I want to do on the university computer because then
Right.
people can see my search history.
Yeah. You'll get a call from HR.
This is science, I swear.
I do want to ask you, though, about my department, ear surgeries.
Oh, okay.
Because, over the years, there's certain breeds, and you named Cocker Spaniel earlier, which
Yeah.
made me think. I mean, Janet, there are so many dogs that ear infections let go for a while, or some dogs respond hyper to try to get their ear infection, cured.
Yeah.
And then you get all this extra tissue in there, and then it hardens. And then they have to see Dr. Tobias for surgery. And that's all surgery along here.
Well,
And
wait,
you
what
know-
what gets hard in there?
the what am I trying to say, Karen? Not the collagen.
So they have cartilaginous
Cartilage.
L-shaped canals, and they're lined with epithelium, kind of like skin, and that epithelium and the cartilage will get thick and proliferative.
Janet, when you feel it, it's like rock hard.
And
You have to cut that out. Surgically.
yeah, and there's actually a condition called cauliflower ear in wrestlers.
Right.
Where they've been hit a couple
Really?
of times, and they
Oh
get
yeah, they get whacked on. Yeah.
right. But there's
It's gross.
there's a recent paper out on using laser to actually take out some of those proliferations and having reasonable success. That'd be something a dermatologist does. So I don't know how successful that is in dogs. It's just reported that it could be a possibility. But when they come to me, I have to take their ear canals out.
But
And
does
Janet-
that affect their hearing?
Well, it depends on how you think about hearing. When you think about the way that dogs are hearing naturally, and you have air,
Yeah.
sound waves going in, and
And
vibrating.
this going on.
Yeah, if those canals are full of tissue, you're not going to have the air going down into the canals. So the way
Yeah.
they're hearing is by vibrations along their skull, which they'll have either way if the inner ear is actually working. But the inner ear is pretty delicate, and so with chronic inflammation and stuff, the little hair cells that are in there, they're going to get all stiff and they're not going to work. So taking their ear canals out is not going to cause a major change in their hearing for most animals because they've already lost a lot of their hearing.
So I have a really dumb, but does the whole ear canal, does it come out like a piece, like whole?
Oh my gosh, the ear canal is so beautiful. Oh my goodness. So the skull has bony rings,
Uh-huh.
and then over that bony ring is another cartilage ring,
Yep.
and over that next cartilage ring is the funnel. And so it's a three-piece system that collapses like a telescope so that the dog can do this
Yeah.
and do this. And
Yeah.
oh, the ears are so pretty.
Oh,
Wow, and complicated.
And complicated, very complicated. I just learned an interesting fact. There's a little vein in front of the ear canal that I just tell people, well, try not to hit that. Turns out that drains the temporal lobes of the dog's brains. Oh my God.
It drains.
I
the
was going to
wow.
ask you if you have ever seen an ear infection so bad that it affected the brain.
Yes. Yes,
Ah.
quite a bit. But we take out the ear canals, and we open up the middle ear and let the infection drain out, and a lot of times they get better. So
So I'm a horrible mother because I'm yelling at my son, Kyle, 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 and I'd go, what's with you? You're not listening to me. You don't hear me. I'm yelling. He goes, I swear to God, Mom, I didn't hear you. He was like 10 years old, and I'm like, come on, right? So I'm like, that's it. And I go, what's your problem? Well, so we go to the pediatrician for like a regular checkup, and they do that thing where they put the thing on, and then the lady's turning it, the nurse, and then the kid goes like this. And I'm looking at the nurse. The kid's head is here, and here's the nurse, and she's going, and he's going,
oh no.
and I'm behind him going. And it turned out he had like double swimmer's ear, serious infection, and he really couldn't hear me.
Oh
Did
man.
it hurt though? I mean,
No. So what we had to do then was we had to put, after every swimming thing, we had to do drops of alcohol in there, each
Yeah.
side. I guess it dried out the water. But I was like the worst. You heard me. You didn't answer me. You know, the poor kid is like, I don't really hear you.
I just think how many of these dogs have been in chronic pain for so
Yeah.
long.
Yes, that
And they
is
shake.
amazing.
They shake.
Yeah, that's one
Right?
of the big discussion points here is, wow, anesthesia says, oh, that's such a painful surgery. What I find is when I take those ear canal out and open up the middle ear, like those children screaming on the planes, open up the middle ear.
Yeah.
Next day, the dogs are so much more comfortable.
Yes.
So the fact that their condition was so painful, it
Oh.
must be jaw aches and headaches and
Yes.
just terrible. So
Poor
it's
things.
a lot of those mean Cocker Spaniels, before we had all these really good drugs and treatments,
Yes.
a lot of those mean Cocker Spaniels were just in chronic pain.
Oh, that's
And
so
now
sad.
the medications are so much better. The general practitioners are so much better at dermatology, definitely better than I am on dermatology, that they're really helping these dogs. But it's an awful condition.
Oh.
Can those infections be treated with topicals or oral medication?
Yeah, we start initially with using some topical medications, and there are even some medications that can be applied once instead of 2 times a day by the owner, but applied once, and then you go back into the veterinarian and have them rechecked. And for some ear conditions, those will work. But the issue that we have with some of these is that the dogs have allergies, and if we don't figure out what they're allergic to, they're going to continue to have skin reactions, and a lot of it shows up in their ears and their feet.
And the
So what's
sad
the
part,
most-
Janet, is they're
What?
so painful that when they see the owner coming toward them with their
Oh,
ear
yeah.
medicine. I mean, and I don't blame the dog or cat
No.
for that matter.
Yeah.
And Karen, what I found too is, yesterday I had a vet here in Florida text me about what's my favorite long-acting medication to put in a cat's ears, and I said none.
None.
I said I use very few topicals in cat's ears because what goes in doesn't come out, and so
Well, good luck getting it in there.
What, Jan?
Good luck getting it in there.
As I tell people, you'll get it in the first time.
Yeah. And then that cat's scramming.
Yeah.
But talk to us about polyps, because cats get polyps, Janet.
In their ears
Yeah.
or everywhere?
Polyps in cats are fun. I like polyps in cats. Because, well, and they grow in two different directions. So they can grow down the eustachian tube and into the back of the nose. And those are the cats that'll sound all snuffly and will start having trouble swallowing.
Wow.
Or they can grow out the ear. And so I get to usually take out the ones that are up behind the soft palate in the back of the mouth. And those are really fun. Like, we'll pull out a piece of tissue this big out of the back of a cat's throat. It's so miraculous. And that for the ones
How
inside,
satisfying.
it is. It's very satisfying. And the ones down inside of the ear canal, the nice thing about cats is that they're usually inflammatory in nature, and they're down from the middle ear. And we have polypectomy snares like you use in people, and when you're getting your colonoscopy, if you need your polyps pulled, that's what they'll use. Yeah, but we can put them down in a scope and pull them out of the cat's ears, and then we put them on a course of steroids. And for a lot of cats, that's all we need to do.
Do you tattoo where the polyp was?
Well, if the cat has a regrowth of the polyp after being treated with steroids, then we have to surgically go into that middle ear.
Blue Buffalo natural veterinary diets offer a natural alternative in nutritional therapy. With their in-house research and development team with over 300 years experience in well pet and veterinary therapeutic diets, more than 600 scientific publications, and more than 50 U.S. patents. Blue Buffalo natural veterinary diets.
As a veterinary dermatologist, I can tell you that the chronically affected allergic pet condition, also known as atopic dermatitis, is rarely ever cured, but it can be effectively managed. Command Deep Cleansing Shampoo from Vetramax is a top veterinarian prescribed treatment for skin problems resulting from chronic itch, pyoderma, and allergic dermatitis.
I like to use what my veterinarian tells me to use, which is Command Shampoo by Vetramax. It's super gentle on the skin and tough on that nasty unwanted bacteria. Libby smells great, she looks great, and she loves it.
Vetramax makes practicing veterinary medicine better by giving doctors high-performing, high-value, evidence-based products. Now, with Command Shampoo, you can bring that same quality into your regular home routine. Go to Chewy.com and enter promo code VetramaX15 to save 15% off on Vetramax Command Deep Cleansing Shampoo. Vetramax makes it better. Hey everyone, don't forget to pick up Country Critter Journal if you live in Northeast Ohio. It's a must-read for all pet lovers. Their goal is similar to ours here at the podcast, to educate the community on taking care of pets. They're advocates for adopting from shelters, not puppy mills, and they connect our local communities with goods, services, kennels, and those seeking to adopt a pet. They're a hometown paper with a personal touch. A must-read for all pet lovers, Country Critter Journal.
What's the most interesting surgery you've done on an animal?
Oh, wow.
Interesting.
Any animal, just like, holy Toledo when you got in there.
Is
you
it
know?
like heart surgery?
Well, I've done heart surgeries. I think I had a dog that had a pacemaker that was placed down the neck and into the heart, so it goes through the vein, and it was inside of the heart, and the dog started having hiccuping.
From the pacemaker?
Uh-oh.
Yes, and it hiccuped 80 to 120 times a minute, which happened to be the pacemaker rate, right? And so we realized, there's something, the pacemaker isn't working. We have to keep turning it up even higher. So we went into that dog, and thank goodness I went into the dog's chest through its belly, so I'd have a lot of space. The pacemaker was all the way through the heart, sticking out up against the nerve
Oh my
that moves the diaphragm and causes
Yes.
hiccups.
The hiccuping. Well, I don't know if you've seen this, but some folks are posting on Instagram that the dog swallows one of your earbuds.
Oh, yeah, I saw.
And then
I
you're
saw
playing
that
the
on
music and it's coming out of the dog's gut.
I did not see that.
Oh, like there's been hundreds of them. And they play at like, I don't know, whatever song, like an Elvis song, and you hear it, the dog's lying there and it's coming out of the side of the dog.
Probably hound dog.
Yeah.
Well, you know, wait.
Cat scratch fever,
Wait,
just
speaking-
saying.
Right. Speaking of that, I have read stories of where people, in humans, they had dental fillings and they were getting like radio transmissions.
Mm-hmm.
Of course, that was in the Inquirer.
Okay, so
Just have to be careful what you believe from the internet.
Consider
I'm
the
just
source.
saying that.
But I remember when my kids were little, they got these toothbrushes that you would put in, and it had something to do, it would play music through the bone.
What?
It would play 2 minutes of music, so the kid would brush for the
Oh,
2 minutes
oh,
while
I
they
see.
had the toothbrush. It was like a little electric toothbrush.
Well, you know, speaking of kids, I wanted to
Excellent.
ask Karen, why don't they put tubes in dogs' ears like they do in her kids' ears, in Janet's kids'
Well, I
ears?
never did that.
I know, but
There are some really old papers about putting tubes
Yeah.
in ears, but most dogs don't have middle ear disease. They have
Okay.
disease in
Oh.
outer canals, and
Got it.
so the tubes themselves are probably not going to do anything.
Yeah.
That's going to help them long term. Even short term, it's probably not going to help them. And you know, if you don't take care of the underlying cause, let's say that
Yeah,
the
that's
dog's
true.
got allergies or overproductive adrenal glands or something like that, you're not going to fix the issue.
I
have
have
you
a
done
kind of-
surgery on your own dog ever? Have you had to? Or don't you?
They wouldn't know if they're knocked out, right?
On the
I know, but
dog,
she would know.
Yeah.
I would not have done surgery on my favorite dog.
Oh.
I had other people do that surgery. I've had Dachshund right now. I'd be happy to do surgery on him.
Ah.
He's trouble. And
He's trouble.
I adopted him after he'd been brought back to the animal shelter 3 times.
For
You know-
what? Behavior?
Right, for
Oh.
what? I should have asked that question.
So what are his issues?
Yeah.
Well, you know, he's a dachshund, so he barks and he chews and he digs. But
Oh, that's all.
yeah, he ate a glass jar of peanut butter.
The
Glass.
glass?
ball.
He chewed the glass.
He ate the glass and the 16 ounces of peanut butter. And I
Does
told
he
the
have
pet
separation
sitter-
anxiety? Does he go on walks with
No,
you?
he's hungry. He's a dachshund. They're always hungry. I just said,
Oh,
well, put him out in
my.
the backyard, then we'll see. All comes out.
Well, our sister, our older sister Penny, when I spent my summers with her, and she had a basset,
Oh, yeah.
and it would go into the bathroom and eat the toilet paper, whatever was in the.
No, it ate the razor blades.
It ate the
double-edged
razor blades, those
blades.
old flat razor blades, and we're like, oh my, and nothing ever happened.
And it
Oh,
also
man.
ate the wrapped up man's belt, leather belt. that was
Whether
wrapped
like
up for
braided
Christmas.
belt.
Yeah, we've had a dog that's been in a couple of times for intestinal surgery because it keeps going in the bathroom and getting the dirty tampons, and
Oh yeah,
Yeah.
you know,
that's a big
they're
one.
dogs.
Yeah, right
Yeah.
down the hatch.
Oh my gosh. What's the funniest thing, and thankfully the pet lived, that you've ever taken out of a stomach? That they've ingested?
Oh, the oddest thing, like a strange
Yeah,
object.
the oddest
Well,
thing.
I
Besides Tampax
Yeah.
or underwear.
Well,
Socks.
okay. I would say there's 2. The first one was the one that surprised me because the dog had these little squeaky Heckle and Jekyll squeaky.
Oh, I love Heckle and Jekyll.
Yeah,
Yes.
the little squeaky crows, right? And
Yeah.
and I was doing the gastronomy because it had a stomach obstruction, and I made the incision, and the little Heckle pops out. Like the head came up and out of the incision, and you know I could squeak it. And I turned to the students and I said, "Well, you know where there's Heckle, there's Jekyll." And I pulled it out, and Jekyll pops up, and I went, "Oh my god!" They were both in there.
As someone who's never done surgery other than pulling things out of kids' noses, does it come out clean?
No, it does. It whatever they've been eating.
It's got
in
it on there.
And if it's partially digested, it's in there. Yeah, But I also had a dog that grabbed the crock pot cord and pulled the crock pot off of the countertop.
Oh, my God.
Not my dog, of course. It was
Right.
one of my surgical cases, and ate the roast that was inside, entire roast, and then, because there was plenty of juice, ate the glass lid. And the glass lid is safety glass, so it breaks up like a windshield.
Yeah.
Oh,
And so when we took an X-ray, the dog had glass throughout
I
its
can't even imagine.
its
Like glitter.
stomach, its intestines, and I thought, well, this too shall pass. So we ended up having to empty its stomach out, but everything else went out the other end. The dog was a little uncomfortable when it pooped, but
Yes.
and I'm pretty sure it would not have put those two incidents together.
Oh,
So
my Lord.
note to self: don't leave the cord hanging down.
Well, can you
You
imagine
know,
the
that's
owner?
true.
Wait, can you imagine the owner? Like, where's the lid?
Where's
Yes.
the roast? Where's the?
Just the little plastic knob.
It was just the big metal rim was all that was left.
Was it a big breed dog to get through his jaws through that glass?
Well, it's shattered.
Yeah, the glass
Oh,
shattered.
okay. I thought he chewed it up.
But
Okay.
it's a safety glass, so it just cracks like windshields do in little
Like
cubes.
tempered.
And
Yeah.
the dog just,
Oh, my.
Because it had like beef juice on it.
hey, this is delicious.
Well, I bet like a young resident now wouldn't know Heckle and Jekyll. Like if Heckle popped up, they wouldn't say, like Dr. Tobias said, there must be Jekyll too.
Speaking of,
guess
we
we're
went to a
dating ourselves,
Comic-Con party and you had to go in costume. So I ordered the Spy versus Spy costume,
Oh, yes.
right?
Nobody remembers that.
Wait, the people who are hosting it are Scottish, and we go to their house, and we're out there with like the dynamite with this big nose, and then Donald has like a little fake bomb with the big nose. One's black, one's white, and we're at the door like, and they opened the door and they were like, "What are you?"
Hello.
It was such a letdown. But then once we got inside, the Americans knew what we were from Mad Magazine. But we thought we were brilliant, right? Nobody's going to do this, and nobody did, but nobody got what we
Nobody
were.
got it. Yeah.
And you're right, Heckle and Jekyll they wouldn't get, and they wouldn't get Spy versus Spy.
But I love Heckle and Jekyll now that she mentioned it.
We're going to have to go to YouTube and find some old.
I know.
I'm not sure it's politically correct anymore. I think some of it.
Right.
But yeah.
Oh,
That's right.
correct.
Yeah.
So Dr. Tobias, we're going to ask you what we ask all of our guests. What are you most passionate about in your work?
Most passionate about in my work, I would say teaching and the interactions I get either through teaching or through working with my coworkers, the doctors and the nurses, because being at a university, I learn so much from everybody, including my students. I'll tell the students, will say, well, we just diagnosed a corneal ulcer in this French bulldog, and I'll say, well, why don't you pull out your notes and tell me what the latest is on treating corneal ulcers before we get a consult? And they can tell me about it. So
Oh, that's cool.
it's very, very exciting because I'm always learning, and I love my job. I absolutely love my job. I've got the best job in the world, and so I'm not going to work every day. I'm
Right.
coming home.
With
And-
that dachshund.
What's the
Well,
dachshund's
I'm
name?
coming home when I get to the office.
I
Which
bet.
dachshund? Yeah,
What's
Can't
his
wait to
name?
get to work.
Hamish Macbeth.
Hamish. I was going to say it's Evil Knievel, but
Had I known, I came home one day and I had this box, this 1 pound box of women's vitality mix, which is
Yeah.
raisins, chocolate, nuts.
Oh.
It was all gone.
like trail mix, yeah.
Yeah, it was all gone from the kitchen counter.
Mm.
And he was out in the backyard emptying his intestines, and I thought, And I came back in, and he shot through the dog door ahead of me. He jumped on the dining chair, jumped on the dining table, leapt across to the kitchen bar stool, and got on the kitchen counter, and he had eaten an entire pound. Chocolate and raisins, which are toxic to dogs.
Yeah.
He was great. No,
There's the devil. There's the devil in him. I swear to God.
there's drive. There's drive.
So Dr. Tobias, what is your pet or human peeve? Like, what just gets you?
My pet or human peeve?
I love that word, peeve.
I know.
Well, I think from my dachshund, I would say that he can't control his tongue. And if he's next to somebody, he's constantly licking them.
Oh,
He can't
interesting.
keep his tongue off of anything.
He has issues.
He has issues. So that is my pet, and that is my peeve.
There you go. Good answer.
Have you ever seen the welcome mat that says "Caution: Dog can't hold its liquor"?
Oh, yeah, that's right.
Licker. I
That's
think
pretty
that's
darn appropriate.
hysterical. That's what you need as a little warning sign. Oh my gosh! Well, this has been a pleasure. Wow, this has been incredibly.
Well, this is a
informative.
dream come true for me that I got to meet Dr. Tobias one-on-one. See, Janet, it only took 30 years.
And you're still fanning.
I
Oh.
am. I'm so proud of all of your accomplishments. I swear to God, when at 31, when I went back to vet school, I saw a lot of young people, and I just love to see what they've become, and it's just, I'm so proud of you and thankful for what you do.
Well, thank you.
I
That
really
was so
am.
nice.
And Janet, I know you think I'm fan gushing, but I am.
But you are. That's fantastic.
Because why did I go into surgery? Because I'm in dermatology because I'm terrified of surgery. So any surgeon, I'm like, oh, kudos to you.
Well, kudos to the dermatologist because you keep seeing things over and over and over
Yeah,
again.
that's true. It is
Friends
chronic.
with owners, right?
Yeah, it is.
You get all those like bugs and stuff. That just. Ugh.
I love that. I love when I
know.
find scabies because I know I'm going to get that dog better.
Yeah,
It's when
that's
you
the
don't find
exciting
it.
part of each of our fields is if there are things that we can do to make the animals better and therefore
And
help
that's-
the owners.
And that must be satisfying. I can't imagine being a veterinarian because the pet can't communicate,
Right.
right? So you kind of got to figure it out, as you say, Alice, from nose to tail. And I just can't imagine that'd be frustrating for me.
I
Like,
think
what the
it-
hell is wrong with you?
But
You know?
if you've had children and you had to figure out what's wrong with your baby,
Yeah,
and so it's kind of the same thing.
yeah.
Or-
And our oldest son had colic for 4 straight months. And I got to tell you, it was hell.
What do you do for that? Like horses, we walk them around, but what do you do for
Well,
that?
no, if you watch, if people just aren't burping them and getting them
Oh,
to
so it's
get
like
rid
this.
of gas, so
Okay.
there's some little
You do the legs.
massage and
legs like
medicating
this.
and positioning
Oh.
things you can do to
You
help
put
them
the
up
baby
and out.
seat on top of the dryer. Vroom, 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 vroom.
Oh, is that right? You want the motion.
And then you put the dachshund on top of the baby seat, and then
And you drink a big glass of wine while that kid's screaming, and they just scream uncontrollably.
Oh,
Yeah.
that's so
And there's
sad.
nothing you can do to like stop it.
well,
you
I
know?
think now there was a recent article I was looking at where they've sort of deciphered what some of the baby cries are, and so I think the beauty of having YouTube and the internet.
Yeah.
One, make sure you do your research to find out if it is accurate, but
Yeah.
to get some ideas of what you can do if you have that colicky baby, because
Yeah.
maybe we just haven't figured out how to burp them properly or get some of that gas out of them. So
But
Well,
thank
on
you.
that note,
On that note, thank you for being a part of our
Yes, thank you
craziness
so
and our
much.
informative podcasts.
and
you are
Janet,
very welcome.
I guess we're going to wrap it up, and we wish Dr. Bias so much luck with the dachshund. Hey, so this is Dr. Alice Novotny-Drummond thanking you for joining us today, and
Janet Novotny King, one of the Novotny sisters, who hail from Cleveland, Ohio. Thanks for being a part of the show. We hope you learned something. Thank you, Dr. Tobias. This was super informative. I
Love,
feel
love.
like I know a lot more about surgery.
Well, you are very welcome.
Thank you.
thanks, everybody. Kiss the pets for us.
Bye.
Thanks for tuning in today. We hope you learned some valuable information about making decisions about your pet's health.
And don't forget to follow us on social media and subscribe on podcasts because we love to have those likes. Thanks so much for listening.
That's actually really good. You could both go bye-bye.
Bye-bye.
Yeah.
How about woof woof?
This episode of Speaking of Pets podcast was sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. And Vetramax Veterinary Supply. Vetramax makes it better.
Follow us on social at Speaking of Pets and listen wherever you get your podcasts.
The Speaking of Pets podcast is an SLA video production.